Hi, welcome back to the online veterinary technician review course. We're on now to module 2 and it's going to be anatomy and physiology. So this one's quite a heavy module and we're going to start with connective tissues. So there's 4 primary types of tissues found in the body. Okay, the first one is epithelial tissue, which you can see right here, and this is on a cellular level what epithelial tissue will look like. There's also connective tissue, and if you take a look here, this is what connective tissue will look like. And then muscle tissue down here, which is striated and looks quite different than the other types of tissue. And then there's nervous tissue down here. So we're going to cover all 4 of these types of tissues. So again, types and subtypes of body tissues. We have our epithelial tissue, our connective tissue, our muscular tissue, and our nervous tissue, which we just talked about in the last slide. And of course, there's a subcategory to every subcategory. So there's a whole bunch of different types of epithelial tissues as well as connective and muscular. So we'll talk about those as well. So let's begin with connective tissue. So the function of connective tissue, basically it forms a connection between other tissues, okay? So hence the word connective tissue, it connects. It forms a protective sheath around organs and helps insulate the body as well. Acts as a reserve for energy, provides the frame that supports the body, and composes the medium that transports substances from one region of the body to the other, and plays a role in the healing process and in the control of invading microorganisms. So let's talk about all of that. So the connective tissue is composed primarily of 2 elements. It's going to be a cell and as well as, or various cells, as well as a matrix. So in regards to the cells of connective tissue, the types of cells found vary depending on the types of tissue they support. For example, red and white blood cells are found in the blood, which is a fluid connective tissue. And within this module, we're going to start talking about blood and red blood cells and white blood cells, and we do refer to them as a type of connective tissue. So the red and white blood cells are the cell part of the connective tissue. Adipocytes are fat cells found in adipose tissue. Okay, so fatty tissue within the body are composed of cells that are called adipocytes. And fibroblasts are cells that are found in large quantities in many different types of connective tissues as well. So within these modules, we're, especially anatomy and physiology, we're going to be referring to textbooks that you guys have already received. So I highly recommend you guys do some further reading and in your clinical anatomy and physiology for veterinary technicians textbook that you have. So now that we've discussed the cells of the connective tissue, let's talk about the matrix, okay? So it can be thought of as a substance in which the cells are embedded, okay? So the cells basically are in the matrix. One very basic way to visualize this is to imagine jello with chunks of fruit in it, okay? So the jello is the matrix and the fruit represents the cells. So the cells are within the matrix. The fruit is within the jello, okay? So it can be fluid, semi-fluid, gelatinous, or ground substance and protein fibers, okay? So a ground substance is a supportive medium made up of water and large molecules. There's 3 different types of protein fibers found within the matrix. There could be collagen fibers, elastic fibers, and reticular fibers. So 3 different types of fibers that'll make up the matrix in connective tissue. Collagen fibers are very strong strands of collagen. They provide flexibility, and they're found in tendons and ligaments. There's elastic fibers, which are very stretchy and assume their original shape after being stretched out, and they occur in tissues commonly subjected to stretching. For example, vocal cords, your lungs, your skin, the walls of your vessels, things that will expand and contract will have elastic fibers in that type of connective tissue. And then there's reticular fibers, which is a very thin collagen fiber. It provides support for highly cellular organs, for example, endocrine glands and lymph nodes and spleens and bone marrows and livers, also found in blood vessels, nerves, muscle fibers, and capillaries as well. So there's different types of connective tissue. So there's 5 different types. Okay, the first one we're going to talk about is loose connective tissue, and you can see the red arrow is pointing to what that would look like microscopically. And of course, a subcategory to every subcategory. That loose connective tissue has 3 different subdivisions: areolar tissue, adipose tissue, and reticular tissue. And we're going to go through each one of these. The second type of connective tissue is dense connective tissue, which you can see down here in the second picture at the bottom, and it looks quite different than the loose connective tissue. And of course, the subcategories to the dense connective tissue would be dense regular tissue, dense irregular tissue, and elastic tissue. The third type of connective tissue is cartilage. There's hyaline cartilage, elastic cartilage, and fibrocartilage within our body, and we're going to talk about each one of those types of cartilage. Our bone is considered a type of connective tissue. Remember at the beginning slides, I had said they make up the structure and they hold the structure of your body. Well, that's what we're talking about, the bones, okay? And then the blood, which is a form of fluid connective tissue. And again, this slide just reiterates the different types of connective tissue and then their subcategories. Okay. So these type of connective tissues, let's go through each one of them and talk about them. And the first one that we had mentioned was loose connective tissue. And then the loose connective tissue can be areolar, adipose, or reticular. So starting off with areolar loose connective tissue. So it's Latin for a little open space. So it's strong enough to bind different tissue types together, yet soft enough to provide flexibility and cushioning. So the predominant cell is the fibroblast, and this fibroblast manufactures the elastic, reticular, and collagenous fibers discussed on slide number 7. But it's the fibroblast that's going to manufacture all of these. So the areolar tissue surrounds every organ. Okay, so it forms the subcu layer that connects the skin to the muscle. So if you take your hand and you wiggle your skin back and forth, there's going to be a subcu layer of connective tissue there, and that's actually areolar tissue. Areolar tissue also envelops blood vessels, nerves, and lymph nodes, and is present in all mucous membranes. This is a picture here of loose areolar connective tissue, and you can see the fibroblast, which is the very immature cell that makes up these tissues. You can see the nuclei within these fibroblasts. These little strands of what looks like hair are actually elastic fibers, and then you can see thicker strands going down here, and these are collagen fibers. And that's what areolar tissue looks like microscopically. So the second type of loose connective tissue is going to be adipose tissue. Adipose literally means fat, okay? So it's connective tissue in which adipocytes, so fat cells, predominate. It is highly vascular, which means that there's going to be blood vessels supplying blood to this type of tissue. It acts as an energy storehouse and also a thermal insulator. And I don't think that should come to a surprise to anybody. Most people understand that fat provides us with the energy that we need to go about our day. And a thermal insulator, I think everybody can probably think of a really good example where that is very important. For example, whales and these sea animals that are in ocean waters that are freezing cold and have and they have a thick layer of adipose tissue, okay, and referred to as blubber, right? So these animals have a lot of blubber, and that's what's going to keep them warm in these ice cold waters. So again, it's a thermal insulator. Adipose tissue is also found in breasts and around the kidney and in abdominal regions. This here is what adipose tissue would look like microscopically. So you can see the fat droplet. There's a nucleus in there, adipocyte nucleus, and cytoplasm as well. So you can see that's what it would look like microscopically. And the last type of loose connective tissue is reticular tissue. So network of thin reticular fibers. So we talked about this back on slide number 7. The fibers from a soft skeleton, which is the stroma, to support a lymphoid organ. So lymph node, stromal cells, red bone marrow, and spleen. Adipose tissue is held together by reticular fibers. And you'll probably see that in the next slide coming up. Yeah, so in this slide here, you can see that the reticular tissue, it looks like quite a mess. And you can see the reticular fibers that are embedded all the way through that. Okay, so on to the second type of connective tissue. It's dense connective tissue, and there's dense regular, irregular, as well as elastic tissue, which we're going to discuss. So dense regular tissue is the first type of dense connective tissue that we're going to discuss. It's composed of tightly packed parallel collagen fibers. Okay, so again, I keep referring back to slide number 7, so you may have to scan back just to kind of visualize what I'm talking about here. It's relatively avascular, which means that there's not that much vasculature going to those areas supplying blood. Dense regular tissue is what makes up tendons and ligaments. It can be found in fascial sheaths that cover muscles. So the fascia we talked about before in class. We talked about how our muscles have this thin covering over top of it of connective tissue, and we call it the fascia. And dense regular connective tissue can be found here in the fascia. Has very poor blood supply, which is why damaged tendons and ligaments are very slow to heal. This here will show you microscopically what dense regular tissue looks like. You can see the fibroblasts, which are the cells that will form all these connective tissues, and you can see the collagenous fibers that are kind of going in a wave kind of like pattern. And and this is basically if you were going to make a slice of a tendon or a ligament and look at it microscopically, this is what it would look like. Moving on to the second type of dense connective tissue, which is dense irregular tissue. It's composed primarily of collagen fibers arranged in thick bundles. Fibers are interwoven to form a single sheet. They're found in the dermis of the skin and in the fibrous covering of many organs. And they form the tough capsule of joints. So if you guys were to open up a joint, there's going to be a capsule in there. And dense irregular tissue is what covers that. This here shows you dense irregular tissue and what it looks like microscopically. And it gives you a comparison as well from the dense regular and the irregular dense. So you can see it's quite a difference, and I'm sure you could probably appreciate where it got its name from. Irregular, and it definitely looks like quite a mess compared to the dense regular. So you can see the fibroblast nuclei and the collagen fiber bundles and how they differ in these two different types of dense connective tissues. And the third and the last type of dense connective tissue is elastic tissue. So it's primarily composed of elastic fibers. Fibers may be arranged parallel or they can be interwoven with fibroblasts and collagen fibers interspersed. They're found in spaces between the vertebrae and in areas of the body that require stretching. For example, the walls of your arteries, your stomach, your bronchi, and your bladder. So again, all these three different types of dense connective tissue have similarities, right? So they all have the fibroblasts and the collagenous fibers, but again, it's all how they're laid out. It'll determine which locations they're needed and found. This here will show you elastic fibers, and it looks quite different than the dense regular and the dense irregular, but nonetheless it's still a dense connective tissue. And you can see the elastic fibers here. They actually look elasticy, don't they? Looks like they could stretch out, and they absolutely do. So. Okay, the third type of connective tissue is cartilage. So we have hyaline cartilage, elastic cartilage, and fibrocartilage. Let's talk about those. Hyaline cartilage, the first type of cartilage we're going to talk about, is the most common type, and it's composed closely of packed collagen. It's found in joints at the end of long bones, and also found in growth plates of long bones. Your tracheal rings, remember those C-shaped rings that hold your trachea open? It's made up of hyaline cartilage. And connections to the ribs and the sternum. So your ribs will meet ventrally down by your sternum, but remember we were calling them the costochondral junction. Okay, and that's the cartilage part that connects the ribs to the sternum, and it's composes most of the embryonic skeleton. So when we have that embryo that's developing in the womb, they don't just automatically have bones. It has to start with something, and it actually starts with hyaline cartilage, which then further develops into and ossifies into bone. This here, this shows you hyaline cartilage, more specifically within the joint. You can see the muscle and the joint capsule. The hyaline cartilage lies right here at the tip of this long bone, and also right here on the other side. And this dark gray is represented by the joint space, okay? So this is just an empty space that's actually filled with fluid to help with the impact and stuff like that. But on each side of these bones here, we're going to find hyaline cartilage. And later on, we're going to be talking about how bone grow and the epiphyseal plate, which we'll get into later. But again, this all happens around the hyaline cartilage. Okay, so elastic cartilage contains elastic fibers in dense branching bundles. Okay, so it's flexible, hence the name elastic, and can withstand repeated bending. So found in the epiglottis, if you guys can remember intubating, when you take your endotracheal tube and you move down that epiglottis, it's not like soft, smooth tissue. It actually has a little bit of structure to it, and that's because it's actually cartilage within that epiglottis, and it's specifically elastic cartilage. And the pinna, the ear flap in our cats and dogs. It's not just soft, floppy tissue. It actually has some structure to it, and that's because there's very thin cartilage in there, and it's specifically elastic cartilage. Okay, fibrocartilage is the last kind of cartilage we're going to talk about. It's usually found merged with the hyaline cartilage, which was the first type of cartilage we talked about, and dense connective tissue. So it contains thick bundles of collagen fibers with fewer chondrocytes than the hyaline cartilage that we talked about, found in spaces between the vertebrae and the spine and between bones in the pelvic girdle and in the knee joint. So the fibrocartilage usually corresponds with the hyaline cartilage. And you can see this picture here shows you the fibrocartilage, and this right here is the pubic bone, and you can see the pubic symphysis right here in the middle. And we talked about that pubic symphysis with birthing mothers and how that allows for flexibility for that pelvis to open and close during birth. And that's actually made up of fibrous cartilage. So the fourth type of connective tissue that we're onto is bone. Bone, okay, so it's a matrix. Matrix is a combination of, so the matrix of bone is a combination of organic collagen fibers as well as calcium, okay, calcium salts. The bones are very well vascularized. A lot of people are under the misunderstanding that bones are just this solid mass and nothing goes in or out of them, and that's absolutely false. They're very well vascularized, so there is vessels going feeding into the bones. And the Haversian canal are a series of tubes within the bone, and this is what contains the vasculature, as well as nerves can pass through these canals, and that's called the Haversian canal. And thanks to them, that's how bones, these hard, solid bones, get to be vascularized. There's something called a caniculi within the bones, and these are channels within the matrix that support passage of blood vessels into deeper portions of the tissues, okay? And then osteoblast is a very important term to understand when speaking of bone. And this manufactures the fibers that are a part of the matrix. Okay, so osteoblast, any kind of cell that has the word blast at the end of it means that it's very, very immature, and then and it usually forms into more mature cells. In this case, osteocytes, okay? And they reside in the lacunae, which is a very small space within the bone. That's where the osteocytes, so bone cells, osteo means bone, cyte means cell, and that's where they live. Cellular extensions pass through the caniculi. And again, don't forget those caniculi are little tiny channels, right, that go deeper into the bone. And there's cellular extensions from these osteocytes that will go through these caniculi. This picture here will show you what I was just talking about. So again, it can get a little bit complex, but what we're looking at here is this is one big chunk of bone here. So if we were to look at, and you can see here the periosteum is just this part right here, and then within that we can see these canals, and remember these are called the Haversian canals, and the Haversian canals are what has nerves and blood going through. You'll hear talk about the Volkmann canal, and that usually connects one Haversian canal to the other. So the spongy bone is within the middle, and do you guys remember what's inside spongy bone? It's bone marrow. That's where the bone marrow is made, okay? And if we were to take out a chunk, there's these circular things within the bone, and if we were to pull that out, you can see a caniculi, and the caniculi are these channels that run all the way through inside this bone. And within this caniculi, there's those little tiny black dots here. Those are the lacunae that I was telling you about, and that's where osteocytes reside. And as well, you can see the Haversian canal going through, which is like this Haversian canal here. Okay. So, with the bone and everything within it, we're going to talk more about that during the skeletal system. So that was just basically a very brief introduction. And the very last type of connective tissue that we're going to talk about, which is surprising to most, is blood. So the matrix of blood, the ground substance is actually plasma. That shouldn't come to a surprise to anybody. We know that the blood flowing through our veins, everything is floating in a substance, and that substance is actually called plasma. And then there's a fibrous component, so there's proteins within this matrix as well. The cells, this should be review for you guys, are erythrocytes, leukocytes, and thrombocytes. So red blood cells, white blood cells, and platelets are the cells that are found within the blood.